The rise of artificial intelligence in healthcare has sparked a critical debate. Can AI doctors outperform human clinicians in diagnosing common illnesses? This episode explores the evidence, limitations, and real-world implications of AI's growing role in medical diagnosis. Drawing from a range of sources, we examine the strengths and weaknesses of AI in comparison to human expertise, and consider what this means for the future of healthcare. Through a series of structured chapters, we will build a coherent argument grounded in evidence, and propose a grounded scenario that reflects the current state of AI in medical diagnostics. Can AI doctors diagnose common illnesses more accurately than human clinicians?
This information and provide highly accurate predictions of the patient's diagnosis, treatment options most likely to succeed, as well as the prognosis.
Can AI models provide more accurate diagnostic predictions than human clinicians? AI models can rapidly process medical data and provide accurate predictions in controlled settings, as seen in studies on diagnosing deforming osteoarthritis. However, these results may not translate to real-world scenarios where patient history, emotional context, and communication are critical. In the future, AI could assist doctors by quickly analyzing patient data and suggesting potential diagnoses. Doctors might still be needed to interpret results in the context of a patient's full medical history and emotional state. This collaboration could improve diagnostic accuracy and patient outcomes. Research highlights challenges in AI implementation, including data complexity and limitations in interpretability and adaptability.
Top 3 symptoms you expect when a patient presents with cervical cancer. The LLMs are probably thinking cervical cancer must be the cancer of the cervix. But what about neck cervical cancer?
Can AI systems misinterpret medical terminology, such as cervical cancer? Recent studies show that AI systems, particularly large language models, LLMs, can struggle with medical terminology ambiguity. For example, in a study evaluating CPT coding in plastic and reconstructive surgery, baseline LLMs demonstrated inconsistent performance, especially with complex procedures. Another study found that integrating multiple LLMs improved EHR documentation accuracy, but challenges like misinterpretation of medical context and occasional omissions remain. Imagine a future healthcare setting where an AI system misinterprets cervical cancer as cervical spine, leading to a misdiagnosis and inappropriate treatment. This highlights the critical need for ongoing refinement and oversight of AI systems in medical contexts to prevent such errors. These limitations in understanding nuanced language remain a concern, even as AI improves in other areas. These findings are based on verified research and studies from reputable sources, showing that AI systems may still face limitations in understanding nuanced medical language.
Thousands of images in seconds. In breast cancer screening, some AI models match specialist accuracy. In certain narrow tests, it even won. Some studies showed error rates dropping when AI assisted. In skin cancer detection,
can AI match specialist accuracy in breast cancer screening? Evidence suggests it can in controlled settings. Recent research indicates that AI can match the accuracy of specialists in narrow diagnostic tasks like breast cancer screening, particularly in controlled environments. A study published on EXCERPTS explores AI's role in detecting breast cancer from mammograms, highlighting its potential for speed and consistency. In the future, AI could assist radiologists by rapidly analyzing mammograms and flagging potential abnormalities. However, complex cases with ambiguous symptoms would still require human oversight for final diagnosis. This hybrid model could improve efficiency while maintaining the nuanced judgment of medical professionals. However, these results are often derived from highly controlled studies and may not reflect the variability of real-world clinical practice.
The Unfold AI software has proven to be a game changer, accurately pinpointing the scope of prostate cancer with more precision than our human counterparts. Now, hold on to your hats because here's the kicker.
Can AI detect prostate cancer with greater precision than human doctors? A 2024 study found that an AI tool performed similarly to an experienced radiologist in detecting clinically significant prostate cancer. Another 2026 study showed AI models trained on radiology reports outperformed traditional segmentation models, and even surpassed radiologists in detecting multiple tumor types. In the near future, AI systems may be integrated into routine prostate cancer screening, offering faster and more consistent analysis of MRI scans. Doctors could use AI as a second opinion tool, reducing diagnostic errors and improving patient outcomes. AI might be used to detect prostate cancer with greater precision, but it would still require human oversight for final treatment decisions. AI has shown comparable performance to radiologists in detecting prostate cancer, but its role in clinical practice is still evolving.
This is especially important in cases where a disease is rare or difficult to diagnose. AI can also be used to create personalized treatment plans for patients.
Can AI outperform human doctors in diagnosing rare diseases? AI is being tested to help diagnose rare diseases, where limited data and expertise often slow down human doctors. Studies show AI can analyze symptoms, genetic data, and medical literature to improve diagnostic accuracy. In the future, AI could rapidly analyze patient data and suggest potential diagnoses for rare genetic disorders. Imagine AI helping doctors identify rare diseases earlier, using routine blood tests and other available data. AI might assist in creating a more accurate and faster diagnostic process, especially for complex cases. However, AI systems are only as reliable as the data they are trained on, and they may struggle with cases outside their training scope.
Decisions. What it can do is analyze enormous amounts of medical data and detect subtle warning signs hidden inside that data. And that matters, because cancer is often easiest.
Can artificial intelligence detect cancer earlier than human doctors by analyzing vast medical datasets? AI is being used in early cancer detection through technologies like AI-enhanced nanospectroscopic screening, AI-NSBS, which combines nanospectroscopy with machine learning to identify cancer markers in liquid biopsies. Research also shows that deep generative AI models can analyze non-coding RNA to detect early-stage non-small cell lung cancer. In the near future, AI could flag early cancer signs in routine blood tests, prompting doctors to investigate further. Patients might receive earlier diagnoses, but reliance on AI alone could lead to overdiagnosis or missed cases if human oversight is lacking. AI could become a powerful tool in routine screenings, but its integration into clinical practice remains a work in progress. However, these systems are not yet replacing human doctors, as they may miss clinical context such as patient history and symptoms. The evidence suggests that AI can be a powerful tool in specific diagnostic contexts, such as identifying cancer or rare diseases, and in processing large volumes of medical data. However, its ability to diagnose common illnesses with the same accuracy and nuance as human clinicians is still limited. AI lacks the contextual understanding, empathy, and adaptability that are essential in everyday medical practice. While AI may augment human doctors in the future, it is unlikely to replace them in the near term. The integration of AI into healthcare should be approached with caution, ensuring that it complements rather than supplants human expertise.